Welcome to your weekly Energizer. Hey, I am so glad that each one of you has embarked upon this Couch to 5K journey over the next 12 weeks. We are going to have so much fun. So let's go through a couple of things that will happen. Each week at the beginning of the week, on Monday, there will be an email that will go out where it'll have this week's Energizer topic. Secondly, there'll be a link where you can track your progress along with the other folks. And so that way you can record how many days of the plan that you're going, and then along with any tips and tricks for the week. But let's go ahead and dive into the interview that we got with Dr. Marin and Dennis Walker to learn more about getting started on our Couch to 5K journey. I know you're not going to want to miss it. I'm here with Dr. Christopher Marin. Thanks for joining us. Yeah. Sports medicine physician, so you're an all-around expert when it comes to all things physical health and well-being, right?
Try.
Okay. And Dennis Walker. Dennis Walker, you're a physical therapist here at Kettering Health Hamilton. Mm-hmm. So let's just, real quick, let's learn about the two of you for a second. So Dennis, we'll start with you.
Okay.
How long have you been a physical therapist?
Actually, just over 30 years.
Okay, so 30 years. So you have a few years of experience.
A few.
Okay. Yeah. And for our folks out there, what does a physical therapist do?
Physical therapist focuses on return to your optimal level of function. It could be after a surgery, it could be after an injury, or it could just be general health that could lead to that decline. So we just do our best and guide you along on how to get that path back to where you need to be.
Great, excellent. So thanks for sharing that. So you've got a level of expertise relative to getting people healthy and back to just everyday life.
Absolutely.
But here, we're going to keep you healthy right out of the gate. So you don't even need to go see Dennis, but you're going to get the expertise of his 30 years plus wisdom right here. So hold on, buckle up, you're in for a treat. Dr. Marin, how long have you been a sports medicine physician?
About 5 years.
5 years.
A little less than the 30.
Oh, less than the 30, but you went through just a few years of medical school training and residency.
Yeah, about 5 years of medical school and 5 years of training. So.
Okay, and we were talking off camera before. You have a whole host of credentials behind your name that probably sports medicine isn't completely encapsulating all that you have the ability to do.
Yeah, I do a few different things.
Okay.
But for this stuff, it's sports medicine. So
okay,
that's where the passion is.
So, and you also, like Dennis, you help people either diagnose injury, why are they having injuries, but you also do certain types of treatments and prescribe treatment plans, and you also, I believe, do injections and look at nerve work. And
yeah, I take care of nerves, I take care of bones, muscles, tendons, all that stuff. We take care of the high school here, as well as just your recreational, everyday weekend warrior, things like that. And just a few more elite athletes as well.
Well, terrific. Well, you all are elite athletes. You just don't know it yet. So we're getting ready to kick off the Couch to 5K. So we've got a few questions that we're going to talk with Dr. Christopher Marin and Dennis about. So let's get into it. So Dr. Marin, the group that we have, a lot of folks, this is the first time folks have thought about actually undergoing a physical exercise plan. What are a couple things that you would suggest for somebody who is not physically active on a daily basis that they start out with?
Really just kind of go slow.
Go slow.
Start. You definitely need to start, but go slow. Listen to your body. Listen to what it's telling you, but you start slow. Don't feel like if you were an athlete before and you haven't been for a very long time, don't think you can jump back into what you're doing before. I see that a lot where people get injured really quickly. Start slow and just slowly build up. Especially with your bones, the big worry, especially with running, is stress fractures. I see those a lot, especially with people that are trying to get back to it. Mm-hmm. Your bones take a while to start rebuilding the structure that they need to run, especially with that increased force, and just take it slowly.
So the plan that we have actually designed, we were talking a little bit, is actually designed specifically to help move you from inactive, slowly moving you over time. And so really, I think the key, like you said, the kind of the joke in racing, slow is fast. Mm-hmm. And so really going slow. And so Dennis, let's ask you a question here.
Yes, sir.
So Dennis, as you think about as folks are running, should we be out of breath? Should we be just sweating, panting over at our knees? Should we be able to sing a song? What should be the pace as we start exercising that we should start with?
Everybody's body is going to respond differently, especially to a new exercise. Initially, as Dr. Marin said, you want to go slow. You want to listen to your body. You want to let your body kind of guide you. It's important to work at your own pace, gradually building. This can be done by anybody, whether you're inactive, have bad knees, bad hips, just getting that general mobility going is important. But if you do feel sharp pain or nausea or dizziness or anything, listen to your body and allow yourself time to rest.
So Dennis, oftentimes people whom you see actually have maybe gone a bit too far,
Right.
and they're injured. And so what are some of the things that you maybe would have wished that you could have told them beforehand as they were starting?
Well, as we talked about a little bit, you definitely want to start gently. Everybody needs to, again, listen to their body. You want to go at your own pace. You want to slowly build. Any new activity is considered a stress to the body. The body needs time to adapt to that. So just gradually build. The programs that we have are set up for active participants. Basically, a plan for anybody, and anybody can do this.
Cool. So Dr. Marin, let's talk a little bit about physiology. What's going on with the body here? So you talked a little bit about the bones, but what's happening with the muscles during exercise, and then what's going on?
So especially as you're starting to train, if you're kind of going from more of a sedentary lifestyle to more of an active lifestyle, those muscles are getting new feedback from nerves to telling them how to fire right. Muscles are reorganizing, breaking down, reorganizing as you kind of get stronger and get used to the endurance level of running. Tendons are getting a lot of that kind of wear and tear. They can be kind of the weak link between the muscle and the bone. So a lot of times we'll get kind of pain and soreness going on there too. But the biggest concern I usually have is the bone, at least in physiology. So, and that's kind of what we've been talking about, just that gradually build up that allows the bone to restructure itself so that it can take the brunt of running. Which is great, by the way. I'm an avid runner and I absolutely endorse it.
Now, you are actually training to, you're going to try to qualify for Boston. Is that correct? You've got a qualifier coming up?
Yeah, I've got two. I've got a trainer marathon in 2 weeks, and I've got the one I'm really my A race in about 6 weeks.
Okay. So if you all need any running tips, if you see Dr. Marin around the hospital or somewhere out in the community, this is the guy to talk to. And he's underselling it, but he's very quick. So as the bones and things break down, that sounds like a bad thing. Is that really bad, or what's going on?
No, and they're not necessarily breaking down so much as that they're restructuring. If you think of like a building or like a tree so a good analogy is a tree actually. So if you have a tree and it never gets any force, it never gets any wind blowing through it, and never builds up that real structure inside to withstand the wind. Our bones are the same way. If you go out from not running at all to all of a sudden running 6 miles and repetitively doing that, it doesn't have the bone structure internally to support that force. Same thing with muscles and tendons. This gradual kind of onset kind of builds things up. A good example are people that we see in high school athletes a lot is when they're a specific sport athlete and then they take a break for like 6 months. A good example is cross country. They'll run cross country during cross country season, they'll do track season, and then during the summer they won't do anything. And then all of a sudden they go back to cross country season and they think I can run at my 6 minute mile pace and doing 10 miles every day again, and they end up getting stress fractures and sprains and muscle strains and everything like that. And they end up having to sit part of the season out, and then it's this whole catching up thing.
Yeah. So in our Couch to 5K plan, one of the things that we've outlined is what's called run walk, Dr. Marin. And so for folks who don't know, maybe describe what running and walking is. And we've got some tables listed in your training plan, but maybe you could just describe what that looks like and how that actually works in a very practical sense.
So with the program that we're doing, you slowly increment how much running you're doing. And so the whole idea is not for you to go out and I'm going to run a mile all of a sudden. You're going to slowly kind of increase how much you're walking, and then depending on where you're at on the table, it's going to tell you how much to run in between there. And as you go throughout the program, that kind of flip-flops a little bit to where you're running a little bit more and walking a little less. Big thing during that time is pay attention to your body. If you need to kind of go back a step, that's fine. But the whole idea is that you get great cardiovascular health during this time, whether you're running or walking. But the whole idea is to protect you from not getting injured and kind of keep this going even after this challenge is done.
And Dennis, you were going to talk a little bit about some of the benefits of doing the run-walk method.
Yes. Well, actually, running itself is a good thing to do, but you get the same health benefits by walking. You start gradually, it'll still give you the same cardiovascular benefits, the same health benefits and everything. And I like to joke, I've had friends that have walked marathons and they're like, well, I didn't run it. I'm like, well, do you know what they call somebody that finishes last in a marathon? A marathoner. Still a good thing. So running, walking, whatever your level of ability is where you want to be. It's just that change in lifestyle and increasing your activity level gradually.
Excellent. Well, thank you so much for sharing that. And that was one of the things that kind of blew my mind is that if I cover a distance of a mile running or cover a mile walking, it's really the same impact. Really, the difference with the run walk is what I'm hearing you say, and Dennis, what you're saying is really it helps keep us healthy so that we can maintain that into the future, but especially as we're gradually ramping up, because we're able to have maybe run for 10 seconds, walk for 30, and then next time we go out or in a week or so, we maybe do 30 seconds of running and 30 seconds of walking. And just again, listen to your body, listen to what your cardiovascular health is telling you, but it's really staying in that zone where you can have a conversation or sing your favorite Taylor Swift song. So we're all big Taylor Swift fans, just saying. So Dennis, talk with us about the importance. Should we just go out and just go all out for exercise starting out, or what do we need to start to do to kind of prepare to exercise?
Well, when you start a new exercise like this, even if you're an advanced runner, you want to stretch prior to, get your muscles warmed up, get a little bit more limber. You also want to warm up through your exercise. You don't want to go out at a full sprint. That can easily lead to injury and pain. So you want to listen to your body, take your time, work into your activity, and then make sure you stretch afterwards. It's very important.
So as we think about some of the load days, Dennis, what would be a warm up for some of the exercise plan that we have for the group? What would be a couple of things that folks could do to gradually warm their heart rate and get everything firing?
For most people, again, you want to look at your prior activity level and think of where you want to start. But even just a gentle walk to a brisk walk, whatever pace you want to maintain, if you are able to lightly jog, start slow and build and kind of work through from there. It's going to be a gradual process, but it will definitely be worth it.
Okay. Dr. Marin?
I had a speed workout this morning at the track. So just kind of a good example of what I went through. So I arrived at the track. I did about a mile, just easy jogging, just getting my heart rate up, getting my muscles warm because you don't really want to stretch if your muscles are cold. And then I did my stretching, made sure my form was all good, and then I started doing my track workout. And then I did a mile cool down, and then I did a little bit more stretching, make sure everything was some stretching and some mobility afterwards. So exactly what Dennis is saying, those are super important. But that's just kind of an example of what I do.
So in the coming days and weeks, we're going to talk a little bit more about stretching, but maybe just a couple of the quick benefits of why do we stretch, both a little bit before, once we're warmed up, and then after. Why is that important?
So the research is it's been going back and forth between whether you stretch before or after, especially with running. I usually leave that up to whatever the individual feels. As long as you're doing it and you're warm and your muscles are warmed, usually we see more issues when people are cold.
Okay.
But benefits you really are for the mobility. A lot of times what happens is people get very, very tight, especially with running. It's a lot of times it's in the hamstrings. And that can lead to knee problems, especially patellofemoral issues. So I specifically work on my hamstrings. I have horrible hamstrings, so I have to stretch those all the time. But really it just helps with mobility, making sure your joints are moving great, and that you're not having any restrictions like that.
Okay. And Dennis, what would be maybe two or three stretches you might suggest for the group who's going couch to 5K? What would you suggest that they do out of the gate?
As Dr. Marin said, stretching afterwards is probably the most important, but some easy, gentle stretches. YouTube's a wonderful site for learning things, but just kind of getting your calf muscles warmed up to where you hold that stretch for about 20 to 30 seconds
Okay.
is good. You can gently work your hips up and down, kind of glide into things. And you can do what's the traditional runner stretch where you stand and pull one leg up. This might be difficult for some people.
Yep.
But even just standing and working your leg up and down, kind of warming up the muscles
Okay.
is a best. But as Dr. Marin said, even starting with a gentle walk has actually been shown to be as good or better than stretching initially before an activity.
Okay. So let's just real quickly share with folks some of the benefits of exercise. And then I've got a question for you that a lot of folks talk with me about. So I'm going to save that one for you. He doesn't even know what I'm going to ask him yet. So Dennis, what are some of the benefits of cardiovascular exercise?
Well, there's a multitude of wonderful benefits that come with increasing your activity level. Some of the least known, obviously it's going to help your cardiovascular strength and health. It can actually help with diabetes management. It's also been shown to improve your mood, which is important in today's life. Getting out and about can really give you that uplift. And actually, it's been shown to decrease the risks of dementia later in life by staying active. But again, there's a multitude, but those are some of the key points.
So all around, it's good for us, it's good to do, and it has a multitude of benefits, some of which have been studied and some of which we're just now finding out, like the study you referenced on dementia is relatively emerging research that's coming out.
Very good for body, mind, and soul.
So Dr. Marin, when people find out that I'm a runner, and I'm sure you're a runner, you've been asked this question, but Dr. Marin, aren't you going to wear out your knees? So what does the research say about knee replacement in people who are runners?
Actually, running is knee protective.
Okay.
So they actually, one study I read recently, they actually did MRIs of runners after marathons, before marathons and after marathons. And there is a small amount that they go down, but then the cartilage level goes down, but then they redid an MRI a few weeks later and it went right back up. So yeah, the biggest thing to watch for, and kind of why we're talking about what we're talking about right now, is avoiding injury. Injury is generally what leads to more cartilage damage and knee issues. But as long as you're listening to your body, paying attention, and kind of doing the stuff that we've been talking about, usually fine. So yeah, running is knee protective.
Okay.
Yeah, thank goodness.
That is so good news for me because I absolutely love running. And while running may or may not be your sport, this is an incredible way to have a little bit of fun, challenge yourself, and do something that maybe you thought you weren't capable of doing. And so hopefully over this next 12 weeks, you have an absolute blast and you find out that you are capable of something bigger than what you thought of.